how do you think would a dream candidate go about his or her or their interview?
So certainly that's where all your communication skills are being tested. So just like how we're having this interview, the ability to sit in front of camera, speak, look at the camera when speaking, and have at least answers to commonly asked questions clear in your mind. That's kind of the best way to go about it. And practice, there are lots and lots of websites about, okay, these are the commonly asked questions. AAMC, they themselves have a list out there. That's a pretty good place to start. I would say practice, but don't over practice, because if you do too much, then all your answers sound very much like it's rehearsed, that it's not spontaneous. So what I typically recommend is when applicants go for the residency interview, it's called a 5-point rule. That is, have at least 5 points in your mind about your application that you absolutely want to pass on to the interviewer. So whether it was about a research study you did, your teaching experience, a certain clinical experience, a certain US clinical experience, or maybe a hobby, photography, whatever, make sure in that time, 20 minutes or 30 minutes that you have with the interviewer, you find ways to kind of let the other person know about these 5 points, which are key strengths in your application. So for example, there was someone I was interviewing who had a special interest in baking. So she talked about, these are the kind of cakes that I bake. And so she asked the question to the interviewer, could you please describe how, are there any social events or outings that residents participate in? And so this interviewer said, okay, yeah, we go out once a month, we have picnics and this and that. And then she very excitedly said, that's perfect, I can bring my cake along to these gatherings. So so she had it in her mind that I have to make sure this person knows about it, and she found a way to kind of explain that she has that skill that will allow her to fit well into the program. So preparing it that way, doing practice interviews, certainly with consultants like myself or other professionals, mentors, other residents maybe. Wouldn't recommend practicing with family members, but someone who can at least who knows the process and can give you some feedback about that. I think that's the best way to prepare for this interview. So it just takes a little bit practice. It's just another skill, just like swimming or biking, another skill to learn, and it's certainly very doable as long as you keep working at it.